Hello everyone, I'm Paramount Mayor Brenda Olmos. Today we're chatting with Dr. Antonio Beltran about the importance of getting the COVID-19 vaccine. Hello Dr. Beltran, and thank you so much for joining us today.
Thank you, Brenda, for having me here.
Absolutely. So first we'll start out. So please just tell us about yourself, your medical career, and your connection to the city of Paramount.
Well, I could start from the beginning. I've been in Paramount since I was one. Went through all the schools in the Paramount Unified School District. I graduated from Paramount High School in 1994. I went to Stanford for undergrad and did all my medical training at USC. I am currently a pulmonary and critical care specialist here in Long Beach, California under Sound Critical Care Physicians. I am the medical director of respiratory services at Long Beach Memorial, and I'm the ICU director at Little Compton Maria San Pedro.
I can just tell you from all that history, the city of Paramount is very proud of you.
Thank you, Brenda.
So let's start off with talking about the research, okay? So how were researchers able to develop a vaccine so quickly?
I mean, this is a pandemic that we haven't seen for 100 years. And we were seeing what was happening in China, subsequently what happened in Italy. So we've actually been working on a vaccine since January of 2020. In order for you to actually go and approve either medications, in this case a vaccine, you got to go through different processes. Phase 1, phase 2, phase 3 trials, we call it. But I think what really helped us move along quickly was just the need for this, and everyone put in their resources together. And not only that, but a lot of people interested in volunteering, getting people vaccinated to get the numbers in order to get the results. Usually a process like this could take anywhere from 2 years. We were able to do in 6 months, which I think is phenomenal.
Can you speak on the trials and testings that were necessary for the FDA to authorize emergency use of the 3 vaccines?
Any kind of study that you do for any kind of medication is a certain study that everyone does. It's in this case, it was a multinational, different countries. It was a randomized, double-blinded study, which means that the people receiving the vaccine didn't know if they were getting the real vaccine or getting the placebo. The researchers didn't know if they were giving the real vaccine or the placebo. So it really made sure that everything was clean, because you really want to find out, is this vaccine going to make a difference? You have to go through, like I said, the 3-phase trials, and you go from 1 to 2 to 3 until you're able to finally say, hey, this medication not only is safe, but it's efficacious for us to use. And that's when the FDA finally says, okay, we're going to approve this medication.
Wow. So there's a process.
A big process.
A big process. Can you speak to the known side effects of the 3 vaccines and how common it is for people to get these side effects?
They all have very similar side effects. You're going to expect to feel something. The most common side effect is going to be pain at the site of the injection. There could be some redness, there could be some swelling. Other common side effects, headaches, some myalgias, fatigue. This is what your body does as it's developing the army cells to fight this virus. So you're going to expect that, but mostly all the vaccines, nothing serious, and only lasts 1 day.
Has the CDC or other public health organizations identified known physical or health conditions that would prevent someone from taking the vaccine?
That's a big question that I get from a lot of my patients. I have diabetes, I have hypertension. Do I really need to get the vaccine now? Any type of comorbidity, because the people that were really getting sick, that were ending up in the hospital, were patients with diabetes, obesity, high blood pressure. And that's what we commonly saw. So you're more likely to get sick. So it's better for you to get protected and get vaccinated. Other people, pregnant people, that's another question. Well, should I get vaccinated if I'm pregnant? All in all, the recommendation is to get vaccinated. I know some of my colleagues and my nursing friends did get vaccinated during their pregnancy, and it's been shown that it's safe for the mother, for the fetus, and if they're breastfeeding as well, it is safe as well.
So I think kind of going to the second question, so the question was, should these persons consult their physician before getting the vaccine?
Yeah, I mean, I think it's always safer to have an open dialogue with your physician, but I think for the most part, it's safe and they should get vaccinated.
And why is it important for eligible Paramount residents to get vaccinated?
It's not just for worrying about the people that have the immunity, but you got to worry about everyone. And we got to stop that propagation of the disease. And so everyone needs to do their part, including adolescents.
What are your hopes for the Paramount community post-pandemic?
Here, especially in Southern California, there was a disproportionate mortality of Latinos and minorities just in general here. But we have big issues with diabetes, with obesity in our community. And so we saw that. I mean, I was having patients that were young, healthy, 20, 30-year-olds. They were just obese. And when they get sick, they would get sick. I saw so many people die. You know, ongoing health, promoting health with, you know, a lot of our Latino, you know, we like to eat our carnitas, and, you know, there's issues with cholesterol. And so promoting just a good, positive, healthy lifestyle is important. People need to understand, if you get vaccinated, you will not end up in the hospital. Since we've been vaccinating people, I have not had one patient in the hospital because of COVID symptoms or complications. Zero. Just a few days ago, I had a 39-year-old patient who was otherwise healthy, but she was big. She passed away on me. And before she got super sick, I asked her, how come you didn't get vaccinated? You know, I don't. Her sister got COVID. I mean, her family just recently got COVID, her whole family. And unfortunately, she ended up passing away, and there was nothing that I could do about that. You could do something about that, right? And that's why your role here, I mean, for doing this production is important, because our people need to hear this. Unfortunately, with COVID and with the vaccine, people politicized it. You're either on one end or you're on the other, and you don't believe in masks, you don't believe in the vaccine, and leave politics out of, you know, our medicine. Let us take care of patients, but that's what it's come down to, unfortunately. We've been getting vaccinated our whole lives. It shouldn't be an issue, and that's what I want to convey to my community. I don't want to see any more of my residents in Paramount die anymore. I've been seeing it for too long now.
Absolutely, and I think that's the important message that we're trying to get out today. So, Dr. Beltran, thank you so much for your time, for you coming out and talking to the community of just the importance of the COVID-19 vaccine, and we appreciate you very much. So thank you again.
No, thank you. Thank you for having me here. I mean, Paramount is dear to me. You know, I was just recently voted for the first Hall of Fame for Paramount High School.
Right, congratulations.
Thank you. And so, you know, if there's anything you need from me, I mean, I'm always willing to help my community here.
Absolutely.
I still got my papa here in Paramount, so we're still thriving.
Absolutely. Well, thank you so much. Appreciate you.
Thank you so much,
Alrighty.
Brenda.